You crazy demon bird! My hand! It's broken! No! Who should I ask to cure this? I know! Hey Socrates, what are you up to?
Oh, just pondering the meaning of life.
I need your expertise. I fell out of a window and need my hand fixed. But with so many options for medical treatments in the ancient world, I'm not sure which one to use. My question is, essentially what persuades ancient people to choose one treatment over another?
Well, stick figure, I've met a lot of people in my lifetime, and I've asked a lot of questions. Perhaps I can help you with this question by explaining to you, based on my own discussions and readings, what the ancient community really wants from medicine.
Yes, please tell me what ancient people expect from medical treatment.
The patients of antiquity expected to be empowered in their medical treatment. They wanted to be active participants rather than passive recipients. For example, Christian healing depended on the level of faith of the patient. It thus empowered the patient and improved outcomes through divine intervention. Moreover, healing at Asclepions relied on the dreams of patients, once again making the patient an active participant in the treatment process. Lastly, empirical healing models like those of the Hippocratics or Muslims also empowered the patient because they made the patient actively follow directions and maintain a proper exercise and diet regimen.
That makes sense, especially if you look at the tragedy of Oedipus Rex. Oedipus' insistence on finding the truth about his city's condition shows that ancient peoples desired control over their own destinies, even if that meant dire consequences. Oedipus wanted to actively change his destiny and condition, rather than accept his condition as it was, which is why he ran away from his home. If his stubborn sentiment was so strong in matters of birth, it would make sense for it to be also strong in matters of disease and death. Based on my common knowledge of Oedipus, I agree with you that the ancients strive for empowerment through their medical treatments.
Yes, and since you're bringing in the works of Sophocles, I would like to bring up Philoctetes. His story shows that ancient patients did not just want their medical treatment to cure only their physical illnesses, but that they also wanted it to cure the societal stigma and psychological distress caused by their physical illnesses. In Philoctetes' case, you could even say that the psychological distress outweighed the physical disease itself. A good ancient medical treatment, then, should not only cure the physical disease, but also should integrate a patient back into normal society by addressing the psychological distress that inadvertently follows physical diseases.
Yes, everyone has been making so much fun of me because I fell out of a window. I only hope my doctors don't do that also.
Oh, yeah, you hit on an important point, stick figure. Ancient patients also wanted high levels of empathy in their medical treatment.
So that's three important things that the ancients valued in their medical treatment: empowerment, reintegration, and empathy.
Yes, exactly.
Well, I now know what I should be looking for, but I'm not too sure about what types of medicine there are and which ones I should be choosing.
Don't you worry about that, stick figure. Let me gather the greatest medical minds of the ancient age so they can tell you about their similarities and differences so that you can decide which one to choose.
Oh cool, I want to be the moderator.
Co moderator, you mean? The debate's going to be great. It'll be the empiricists versus the faith healers.
Welcome to the Great Ancient Medicine Debate. Today we'll have the empiricists compete with the faith healers to see who's gonna get the chance to cure my broken arm. Here on the left, we have with the empiricists the great Hippocrates, and all the way from Egypt, Ibn Ridwan. They'll be defending empirical medicine.
And on the right, we have the faith healers. From bringing back the dead and taking a thunderbolt from Zeus, we have demigod turned god, the great Asclepius, the god of medicine. With him today is the Son of God, the Messiah, Jesus Christ, representing Christian healing. Also on the team is God's great prophet for the kings, Elijah, representing the Jewish healing tradition.
You've really done it this time, Socrates. I hope these are a great bunch with great powers. But before we begin the debate, can I get some background information on them? Everyone here is from a different background, so are there any similarities between each team?
Good question, Stickfigure. There in fact are many similarities. Both the empiricists and the faith healers cater to the three needs we discussed earlier, which is why both were successful in the ancient world. For example, all of them personalized medicine. Asclepius and Jesus used faith in dreams as a source of treatment. The Hippocratics visited the homes of their patients and learned extremely personal details. And the Jews prayed only to their own God for treatment from illnesses.
Oh wow! In my preparation for this debate, I also remember reading that both the ancient Hippocratics and the faith healers acknowledged the influence of the divine in their treatment.
Yes, that's correct. They all did acknowledge God, albeit different ones. But I think the more interesting question is how all these types of medicines were different from one another. So, with that note, let's get started.
Contestants, we have three categories today. Representatives from both teams will be required to speak on each of the categories. The categories are treatment of disease, transposability, and ethics.
Let's start with the treatment of the disease category. We would like both sides to discuss how they treat diseases. Empiricist, you may begin first.
Well, for us, disease is an external issue. We treat patients based on the conditions and the external circumstances. The air, water, and climate of a place is extremely important in our diagnosis and treatment of disease.
Yes, I agree with Hippocrates. The benefit of this approach of treating diseases by assessing external conditions is that we're able to amass new knowledge over generations and constantly change our approach in response to new illnesses.
Our treatment of disease as external to the patient also better meets the patient's need for empathy. The faith healers treat disease as an internal issue caused by the sin a patient has amassed. They essentially call all diseased patients sinful, unclean, and unworthy.
Faith healers, how do you respond?
Well, we would like to start by rebutting the empiricist. We actually treat disease as both an internal and an external issue. For example, in the Jewish and Christian traditions, some diseases are caused by demons and cured by angels. This is actually better because it anthropomorphizes disease and puts a face to terrible illnesses. A face other than the face of the patient themselves. It allows society not to attach the negatives of disease to the patient and rather attach them to supernatural demons. Take Sarah in Tobit as an example. She married 7 times and each of her husbands died from probably because of an STD she carried, but no one blamed her. They blamed the demon Asmodeus.
And as far as us treating disease as an internal issue of a mass sin, that's actually also better for the patient because it allows us to better meet their need to reintegrate into society. We cleanse the patient of both sin and illness, thereby treating any societal stigma that may not have been warded off by connecting the disease with demons and angels.
It's not just that. We also treat disease as a community, unlike Hippocrates and Ibn Ridwan. They pride themselves in going house to house, but I think that just isolates patients further. We, on the other hand, build communities around disease. Jesus has his Christians, Eliza has his Jews, and I have my Asclepions, where people from all over the world can come and be accepted and healed. This better meets the patient's needs for empathy because they're surrounded by people that are like them.
Oh ho ho ho! Good points on both sides.
I think we have to give this one to the faith healers though.
I agree. Moving on to the next topic, let's talk about transposability, by which we mean the ability of a treatment option to grow, spread, and become better. We can start with the faith healers.
This is actually one of the biggest pros of faith healing. It spreads really quickly. I have 12 apostles who are spreading it for me right now, and I'll have a convert spread it to the Gentiles too.
Moreover, unlike the empiricists, we treat all types of diseases, those that are curable by science and those that are yet incurable as well, making us more friendly for the masses. We don't discriminate.
We're not bounded by climate, place, or time like the empiricists who need to carefully study the air, water, or people of a location before they can treat illnesses. Our treatments are effective no matter where they are.
Something else that makes us even more transposable is our compatibility with empiricism. Faith healing doesn't preclude empiricism. It can actually work with it. We're more open-minded than the empiricists. In other words, we're compatible with empirical healers.
Good points. What do you have to say, empiricism?
Well, the faith healers made some good points, but here's the thing. I acquiesce. Faith healing is more transposable than empirical medicine, but Hippocrates and I will actually argue that it's too transposable.
Blasphemy! The Lord is watching!
What we're trying to say is that the connection faith healing draws between medicine and faith clouds quality. It allows people who are desperate for treatment to be made into fools who can be convinced by quacks. They grow desperate and will possibly believe even untrustworthy sources. True empirical medicine, on the other hand, can only be spread by doctors who are trained in it. While this means that it spreads slower, it allows the quality of medicine to remain high.
And I think I disagree with the faith healers when they try to say that empirical medicine requires years of study of a single place. Initially, it did, yes, but we're essentially trying to build up a knowledge base that we can apply to new situations. Bad air is bad air, no matter if it's in Egypt or in Greece. But the people can be different, so it's important to consider the people in your treatment. So you don't have to restudy bad air in Egypt or Greece. It's bad in both places, and we've established that. So we're more transposable than the faith healers make us seem.
Okay, we're out of time on transposability. Let's talk about ethics. This is a discussion about the moral principles governing the patient and the healer in each type of medicine. Empiricists, start us off.
Oh yes, we have strict bounds on what the doctor can and cannot do.
Yes, we place the blame for wrong conduct on the doctor, not the patient. This allows us to meet the need for empathy of the patient better because it gives the patient the impression that they can do no wrong, which also empowers them more and puts the burden for ethical conduct on the healer.
The faith healers, on the other hand, put the moral burden on the patient because they say that the disease is the outcome of accumulated sin and that the physician is God's agent for medicine on earth. This implies that the physician can do no wrong and potentially encourages ethical misconduct. For example, we don't banish diseased people from society like the priest healers of the Jewish tradition banished lepers.
Oh no, you didn't.
How do you respond, faith healers?
I got you, Elijah. Don't worry. We faith healers do have a response to the empiricists. Yes, we put a moral burden on the patient, but you have to look beyond that a little bit. We are all God's children, and even if someone has sinned, they are equal in God's eyes after they have been properly treated through our means. They are cleansed of both that sin and of their physical ailment. In empirical medicine, a slave is still a slave after being treated. Empirical medicine does nothing to fight discrimination in society, and so that makes it less ethical than faith healing. Faith healing gives redemption to sinners.
And that's all the time we have for the debate, folks. A big hand for our contestants, please. Stick figure, who do you think you'll go to? What's your conclusion?
You know, it's tough to make a choice. Both the empiricists and the faith healers have their own pros and cons, and I think both of them work best in conjunction. Like many other ancient people, I think I will go to both.